This is Radiology in a Minute. My name is Ursulan Rizwan, Deputy Editor of Radiology in Training. We are going to be discussing paper entitled Contrast Agent Administration as a Source of Liability, a Legal Database Analysis by Khan and colleagues in the journal Radiology. The purpose of this study was to explore the clinical context and outcomes of lawsuit claims in the USA relating to contrast-related imaging procedures. The authors analyzed jury verdict and settlement related to medical malpractice for patients who underwent contrast-related imaging procedures from two online research databases. The two legal research databases collectively contain over 1.1 million published summaries of jury awards and settlements. Inclusion criteria included claims in which there was at least one claim of medical negligence against a healthcare institution or healthcare provider. Exclusion criteria included claims in which there were only claims against the manufacturers of contrast agents and not physicians, or cases in which there was deficient information about the cases. Overall, 151 lawsuit claims met the listed inclusion and exclusion criteria. Authors found that the most common complication involved anaphylaxis and the allegation of a failure to diagnose developing anaphylaxis or failure to treat anaphylactic reaction. The second most complication involved contrast extravasation and the allegation of failure to monitor contrast administration or refer patient for treatment of contrast extravasation. The third most common complication involved contrast-induced AKI and the allegation of unnecessary use of contrast-enhanced imaging. Of the 151 lawsuit cases, 51 went to trial. Of those, 68% resulted in a judgment in favor of defendants. 100% of cases of alleged contrast-induced kidney injury were decided in favor of defendants. In the end, authors found that the use of contrast agents in imaging comes with a risk of legal liability. The most frequent allegation related to use of contrast in imaging was of a failure to diagnose and treat anaphylaxis. For more information on the article, please follow the link below.